Tell me your name
Holly Herman.
and tell me who you are.
I'm a physical therapist. I've been a physical therapist for 43 years. I practice in Boston, Massachusetts, and I am an orthopedic therapist, but primarily do work with women and men's health, which means pregnancy, postpartum, gynecological work, prostate, before and after, anal rectal.
Let me stop you there because she does a lot of stuff in physical therapy and she's terrific and a fabulous speaker. And we're at the annual meeting of the North American Menopause Society, and one of the things I heard in your presentation, which was absolutely superb, was the relationship to sexual function and actually your physical structure, your spine, your pelvis, your ankle. Tell us a little bit about how alignment and your bone structure and everything might affect sexual function.
Well, one can look at just thinking about the pelvis and the genitals in and of themselves as the originator of the problem. And many women, many men have that happening, that they have dryness, lack of lubrication, they have some sort of issues that go on that are really to do with the muscles that are going on and also the tissues, the ligaments, all the structures.
So if you actually could have a problem with sex, having enjoyment with sex because the spine in your back or some part of your bone anatomy was not ideally aligned. Is that what you were saying?
That's what I was going to say next, is the fact that you can think of the pelvis and those structures as being the actor, or you can see them as the reactor to the problems or issues that may be occurring in another part of the body. Oftentimes it has to do with the cranium, can be the cervical spine, thoracic spine, and even going all the way down to the foot.
And in those situations, what you're saying is even if the pelvis is working great, these other parts of the body can detract from your sexual experience.
Yes, if you think of it as twists and turns that are going to be affecting the pelvis. If you have something that is going to twist you to the right or take your head to the left or your foot, you can't put your full weight on it and full movement, then it's going to affect what's going on in terms of your pelvis.
So if you were going to say who is someone that would benefit from potentially seeing a physical therapist or someone who is works with women in this way, who would be the ideal woman to see someone such as yourself?
You would want to see people who are talking about having hip problems, somebody who has had knee surgery, somebody who has had multiple sprains of their ankle, anybody who has been in a motor vehicle accident with a seat belt, anybody who has been in a bike accident or has some sort of changes where they did a cartwheel over their bike. Anything that has to do with orthopedics. What we want to think about is how does that relate to the pelvic floor and sexual function.
So the point of this really is, and you pointed out beautifully, is that having a satisfying sex life is not either all in your head or all in your pelvis.
That's correct. It really is an integral, holistic viewpoint. Somebody who has even an adductor, the inside of your leg, spasm from either childbirth or playing ice hockey, can have it so that can restrict what's going to happen in terms of the movements and the function of the muscles and the genitalia.
Well, thank you very much.
You're very welcome. It was such a pleasure.